Well, if you have balance issues, if you're dizzy, you know that it's something that you really want to get fixed. And joining us today to tell us about how rehab might be one of the possibilities, we have Dr. Luke Clayman. He's a physical therapist with Lima Memorial Health System. He's at the rehabilitation at the YMCA. And thanks for joining us today.
Great to be here.
All right, so first let's talk about this. You hear people have dizziness problems or balance problems. How do you know if rehab and maybe you as a physical therapist can help a person out?
So first we like to start by just kind of defining the vestibular therapy that I go through. So vestibular therapy just looks at a lot of the inner ear function, and a lot of it can cause dizziness or balance issues, and some people can get nauseous or neck pain as well because of this. So a lot of times on the first day, you'll be seeing a vestibular therapist, which would be me or my boss, Tony Rampula. And we kind of go through a whole bunch of different testing positions to figure out exactly where the problem with the dizziness or the balance issue is coming from. Sometimes it can come from the ear, sometimes it can come from the brain, sometimes it can even come from your neck muscles being super tight.
Wow. All right. So that sounds like stuff that a lot of different areas. So, all right, what about vertigo, positional vertigo that, hear people that talk about the spinning?
So positional vertigo is interesting because what happens is there's these crystals inside your ear. Everybody has them, but sometimes what happens is they get stuck in the wrong place. So I have a little model of the inner ear right here.
Oh.
And sometimes what happens is these crystals that are down here at the bottom of the ear, they can get lodged up into these little canals. These canals are really helpful in helping your balance because as you move your head side to side, there's this fluid that moves around inside your ear, and it basically tells you which way your ear is positioned, and it helps your brain just kind of figure out which way is up, down, left, and right. When you get these crystals that are stuck in your ear, it kind of creates an imbalance and your brain gets a little confused, and it can give you spinning and dizziness and vertigo. And usually it lasts for about a minute or so. You get really nauseous. And we can fix that super easy by just kind of repositioning those crystals and getting them back to the right spot of the ear where they're supposed to be.
It's fascinating how the ear, you typically just think your ear is for hearing, but apparently your inner ear and the workings control a lot of other different things that you have to work with as a therapist.
Correct. And we always like to take all these other things into mind whenever we're looking at a patient for the first time. So a lot of times patients that I'll be seeing with these inner ear issues, they might also be having some other issues as well, such as they might be deaf in one ear, they might get ringing in their ears, or some people even say, I just feel like I can hear my heartbeat in my ear. And those are all things to keep in consideration as well whenever we're looking at all of the different factors that we're looking at with the vertigo, the inner ear issues, and the balance.
I think many times people are afraid to maybe even come to the doctor or a physical therapist like you because they have these issues and they think, well, I don't want to have surgery or I don't want to take extra medicine or something like that. But apparently with physical therapy, you can fix some of these issues and help people.
Correct. So a lot of the things that we do with our patients is we'll put them through an exercise program. We'll kind of retrain the ears to work a little bit better with your brain and your eyes. We also work a lot on balance training, and we can also work on leg strength and just get your neck stretched out too, because a lot of people will get so tight in their neck because they're afraid to move in different directions that will make them dizzy. So we kind of retrain the body and retrain the brain and the ears to kind of work through that, so that way you can get better and not have the dizziness as much.
Wow. I'm sure there are a lot of people at home thinking, oh, you need to help me. So how do you get in contact with you? Can you make an appointment for this rehab?
A lot of times if you just see your doctor and you just kind of explain what is going on, they can definitely get you a referral and you can see me and we'll take a further look and figure out what we can do for you.
Wow. All right. That's exciting stuff. The numbers on the screen too. Dr. Luke Clayman, thank you very much for joining us today.
Thanks for having me.
All right. Don't go away. First Edition continues in a moment.